When treating a minor head injury, sit them down, treat any scalp wounds, and check their level of response. If they have a severe head injury, call 999 or 112 for emergency help. And that's how we treat someone with a head injury. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Crawling babies can get their fingers into all kinds of places in your home. If they put their fingers into electric sockets or appliances, such as hairdryers or phone chargers, it's possible for your baby to get an electric shock. This can be very serious. If your baby has had an electric shock, you might see some of these signs. They may have burns, blistered or charred skin. They may have pain or weakness. An electric shock can make your baby unresponsive. If you think your baby has had an electric shock, you'll need to do a baby primary survey. If your baby is still in contact with the electrical current, turn the power off if you can, or use something non-metallic to break the contact, like a rolled up magazine or a wooden spoon. Try to see if your baby responds to you by gently tapping or flicking the sole of their foot and call their name. They are unresponsive if they don't respond to you. Martha, can you hear me? Next, you will need to check if they are breathing. To check for normal breathing, open the airway. Place one hand on your baby's forehead and very gently tilt their head back. With one finger, gently lift the chin to open the airway and check to see if they're breathing. If your baby is breathing, put them into the recovery position. Cradle the baby in your arms with their head tilted downwards. If your baby has suffered an electric shock and has stopped breathing, you need to start baby CPR. This technique is for use on babies under 1 year old. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have a speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the centre of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. You may also need to treat burns, move them away from the source of heat, cool the burn or scald by running it under cold water for at least 10 minutes. Don't use ice, gels or creams on the area. They can damage the affected skin and increase the risk of infection. Remove the clothing from around the burn. If the clothing is stuck to the skin, don't try to remove it. Cover the burn with cling film or a clean plastic bag. This protects it from infection. Serious burns or scalds need emergency treatment, so call 999 or 112. While you wait for the ambulance, treat your baby for shock if necessary. So remember, break contact with the electrical current with something non-metallic. Check if they're responding and breathing. If your baby is breathing, then put them into the recovery position and call for help. If your baby is not breathing, start baby CPR. You may also need to treat burns, so cool the burn with cold water, remove your baby's clothing unless it's stuck to the burn, and cover the burn with cling film or a clean plastic bag. And that's how you treat a baby who has been electrocuted. Thanks for watching. Help support St John Ambulance. Donate today.
Priority is to control the bleed and keep the airway open. Help them to sit down, never lie down, and keep the nose above the heart to help to control the bleeding. Get them to lean forward, never backwards. This ensures that the blood drains out through the nose rather than the back of the throat, which may block the airway. Ask the casualty to breathe through their mouth and pinch the soft part of the nose. You can give them a pad to catch any blood that may drain out. After 10 minutes, release the pressure, reassess. If the bleeding has not stopped, apply the pressure for a further 10 minutes. If the bleeding is severe, or if you have not managed to control the bleed after 30 minutes, it is time to call for an ambulance. So remember, get them to sit down leaning forward. Pinch the soft part of the nose. And if necessary, call for an ambulance. And that's how you treat a nosebleed. In this video, we will teach you what to do if you found someone collapse. The initial assessment is called a primary survey. This is a quick, early assessment to establish how best to treat a casualty in order of priority. We can use the initials Dr. ABC or DRABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. So, when I see a casualty, first, I'm going to check for any danger to make sure it's safe for me to approach them. I don't want to become a casualty myself. Then I'm going to see if I can get a response from the casualty. As you approach, introduce yourself. Ask them questions to try to get a response. If they're not alert and do not respond to your voice, kneel down beside them and gently shake their shoulders. Hello, Amy. It's Winston. Can you hear me? Open your eyes. Still no response? You can pinch their earlobe to see if they respond to pain. Depending on how the casualty responds to you, will establish a level of response. We use the AVPU scale, and each letter can represent the casualty's level of response. A, alert. V, response to voice. P, response to pain. And U is the casualty unresponsive to stimuli. If there's still no response, they are unresponsive. We need to check the airway. Is the casualty alert and speaking to you? You know that there's no problem with the airway, it is clear. If the casualty is unresponsive, open the airway by putting one hand on the forehead and gently tilting the head back with two fingers under the chin. Now we need to check to see if they are breathing normally. We do this by placing our ear and cheek over their nose and mouth, looking down the body to see if the chest rises and falls. We do this for 10 seconds. If the casualty is not breathing normally, call for help. Ask them to call 999 or 112 for emergency help and bring an AED. If you are alone, call for emergency help using a mobile on speakerphone and begin CPR with chest compressions. The casualty is breathing normally, so I'm going to check their circulation. Are there any signs of severe bleeding? Look and check down the body. If you find severe bleeding, try to control the bleeding to prevent life-threatening shock. Call 999 or 112 for emergency help before continuing to treat the casualty. You may also need to treat them for shock. I've established that my casualty is not bleeding. So remember, To do a primary survey, follow the order of Dr. ABC. Complete each step in that order as quickly as possible, dealing with any life-threatening conditions as you find them. Call for emergency help. Call 999 or 112. And that's how we perform a primary survey. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk.
Parents often worry about their baby getting meningitis, and it can be very serious. Meningitis is a serious infection which affects the membranes that surround the brain and the spinal cord. Anyone can get meningitis, but babies and children under 5 are most at risk. Meningitis can be very serious and the baby may deteriorate very quickly. If you suspect meningitis, you must seek medical help urgently, as prompt treatment is vital. Therefore, it's important to recognise the symptoms. Your baby will be very unwell with a flu-like illness and high temperature. They may have blotchy or pale skin. Their hands and feet may feel cold to touch. They may have joint and limb pain. As the infection develops, they may have a severe headache, neck stiffness, vomiting, drowsiness. Their eyes may become sensitive to the light. They may have high-pitched moaning or grunting. They may be very floppy, and they may have a tense or bulging soft spot called the fontanelle on the top of their skull. Later, you may see a distinctive rash of red or purple spots that doesn't fade when pressed. But meningitis can still be the cause of severe illness even if they do not develop a rash. It is unlikely for all of the symptoms to show at the same time, but if your baby is very unwell, do not wait for all of them to appear. If you are worried, seek medical advice straight away. If they have a fever, you should treat it. Keep monitoring your baby, check them for signs of a distinctive red or purple rash which does not fade when pressed. If you see a rash, perform the glass test. Press the side of a glass against the rash. Most rashes should normally fade. If the rash does not fade, you should call 999 or 112 for emergency help straight away, as this is a sign of a later stage of meningitis. While you're waiting for help to arrive, keep your baby cool and reassure them. Keep checking their breathing, pulse, and whether they respond to you. So remember, if you suspect meningitis or notice any worrying signs, seek urgent medical advice. If they have a fever, treat it by keeping your baby cool and comfortable. Check the baby for a rash and call 999 or 112 if you are worried. Keep checking their breathing and level of response. And that's how you treat a baby who you think may have meningitis. Thanks for watching. Help support St. John Ambulance. Donate today. If you think someone has a fever, there are 6 key points to look for. To start with, high temperature, above 37 degrees Celsius, pale skin. They may feel cold with goose pimples, shivering with chattering teeth. Later on, hot flush skin and sweating, headache and general aches and pains. Take their temperature using a thermometer. If it's above 37 degrees Celsius, it's a fever. Give them plenty of cool drinks to replace any fluids they lose from sweating. If they are feeling unwell, you can give the recommended dose of paracetamol. But remember, don't give any aspirin-based product to anybody under the age of 16. If you are worried about their condition, then call their doctor's surgery for some advice. If their temperature is above 39 degrees Celsius, then call their doctor or the NHS advice line. If their condition worsens, then call for an ambulance immediately, and if it's a child, be prepared to treat them for a seizure. Remember, check their temperature, keep them cool, give plenty of cool drinks. If their temperature is over 39 degrees Celsius, seek medical advice, and if their condition worsens, call for an ambulance. That's how we treat a fever. If your baby is unwell and has a fever, it can be very worrying. If you think your baby has a fever, there are 6 key things to look for. Early on, you might notice a high temperature, above 37 degrees Celsius. They may have pale skin. They may feel cold, with goose pimples, shivering and chattering teeth. Then later, you might notice hot, flushed skin and sweating, a headache, and general aches and pains. Take your baby's temperature using a thermometer. If it is above 37 degrees Celsius, it's a fever. Help make them comfortable and don't overdress them or remove too many clothes. Don't cool them down so much that you're making them shiver. Give them regular drinks. If they're breastfed, feed them regularly. And you can offer them water to drink. This will help keep them hydrated and replace any fluid they may lose from sweating. If your baby is distressed, you can give them the recommended dose of paracetamol. Remember, always check the information on the container and don't give aspirin-based medicine to anybody under the age of 16. Check your baby frequently, including during the night. If you're worried about their condition, they have a seizure or fit, then call 999 or 112. A temperature above 38 degrees Celsius is unusual under 3 months, or over 39 degrees Celsius above 3 months. Call for a doctor or NHS Direct for advice. If they seem to be getting worse, then call 999 or 112 for an ambulance and be prepared to treat them for a seizure. So remember, check their temperature and keep them cool. Give them plenty of fluids. If their temperature is over 38 degrees Celsius for a baby under 3 months, or above 39 degrees Celsius in a baby over 3 months, get medical advice. If they're getting worse, call 999 or 112. And that's how you treat a baby with a fever. Thanks for watching. Help support St John Ambulance. Donate today.
Heat rash or prickly heat is an itchy rash of small red spots that can cause a stinging or prickling feeling on the skin. The rash can be anywhere on the body, but usually people get it on their face, their chest, back and thighs. It is caused by sweat glands becoming blocked, so people usually get the rash if they're sweating more than usual. Heat rash isn't serious. It will usually go away after a few days, so it doesn't normally need medical attention. There are 4 signs of heat rash to look for. Itching, a rash of tiny red spots, mild swelling, and a prickling or burning feeling. If someone has heat rash, you should explain that a rash is not serious, but give them tips on how to soothe the itching and avoid getting the heat rash in the future. You can suggest to take a cold bath or shower to cool the skin and help prevent further sweating. They can also buy calamine lotion or hydrocortisone cream, which will help to soothe the itching. Recommend that they wear loose clothing made of cotton, as cotton doesn't trap heat as much as synthetic fibers like nylon and polyester. Tell them to drink plenty of water to stop them getting dehydrated, and suggest they avoid excessive heat or humidity by staying out of the sun and not sitting too close to a fire or heater. So remember, when treating heat rash, suggest a cold bath or shower, use calamine lotion, suggest loose clothing, and drink plenty of water. And that's how you treat heat rash.
To bandage somebody's hand, use a roller bandage. Place the bandage on the inside of the wrist, just below the thumb. Wrap the bandage straight around the wrist twice. Then wrap the bandage from the inside of their wrist diagonally across the back of their hand up to the nail of their little finger, straight across underneath the fingers and diagonally back across the back of their hand to the outside of their wrist. Pass the bandage under their wrist and repeat, diagonal over the back of the hand, across the fingers and back again. Keep going the same way, bandaging diagonally across the hand like a figure of 8. But each time, only cover about 2/3 of the previous layer. Each new layer should be covering 1/3 of new skin. Make sure you leave the tips of their fingers peeking through. Once you've covered the whole of the hand, wrap the bandage straight around the wrist a couple of times and secure with a pin or tape. To check the circulation, squeeze the fingernail for 5 seconds. When you let go, if the colour doesn't come back within 2 seconds, it means the bandage is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, when applying a hand bandage, use a roller bandage. Make sure the bandage extends far beyond the injury site to ensure an even pressure is applied to the wound.
caused by a disruption to the electrical activity in the brain, which may lead to uncontrollable contractions in muscles and unresponsiveness. If a seizure occurs, the most common cause is epilepsy, but it can be caused by other things, such as alcohol poisoning, a lack of oxygen, after a head injury, after taking certain drugs, or if someone with diabetes is having a hypo, where the blood glucose is too low. When someone is having a seizure, you may find they have sudden loss of responsiveness, rigid body with arching back, noisy and difficult breathing, convulsive, jerky, uncontrolled movements, saliva at the mouth which could be blood-stained if they've bitten their tongue or cheek, possible loss of bladder or bowel control. Afterwards, they may be confused, tired, and fall into a deep sleep. If you suspect someone is having a seizure, it's important to protect them from harming themselves during the fit. Clear away any potential dangerous objects like hot drinks or sharp objects. Don't restrain or move them. Make a note of the time when the seizure started and how long it lasts. Protect their head by placing something soft underneath or around it, like a towel, and loosen any clothing around their neck. Once the seizure has stopped, open their airway and check their breathing. If they're breathing, put them into the recovery position. If they stop breathing at any point, prepare to treat someone who is unresponsive and not breathing, monitoring their level of response. Call 999 or 112 for emergency help if it's the person's first seizure, the cause is unknown, they're having repeated seizures, the seizure lasts more than 5 minutes, they are unresponsive for more than 10 minutes, or they've sustained an injury. So remember, protect, but don't restrain them. Call 999 or 112. And that's how you help someone who's having a seizure. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
Survey and establish that your casualty is unresponsive but breathing normally, they should be placed into the recovery position to help maintain the airway. To do this, kneel next to them on the floor. Remove their glasses and any bulky objects in their pockets, but do not search their pockets for small items. Make sure both of the casualty's legs are straight. Then take the arm nearest to you and place it at a right angle to their body with their palm facing upwards, like so. Take the other arm and bend across their chest and place the back of their hand against their cheek nearest to you and hold it there. With your other hand, lift their far knee up until their foot is flat on the floor. Whilst keeping the casualty's hand pressed against their cheek, pull on the far leg and carefully roll the casualty towards you and onto this side, like so. Once you've done this, adjust the top leg so that it is at a right angle. Tilt the casualty's head back so that the airway remains open. If needed, adjust the hand under the cheek to help to keep the airway open. If it has not already been done, call 999 or 112 for emergency help. Keep checking their level of response until help arrives. So remember, if the casualty stops breathing at any time, call 999 or 112 and prepare to give them CPR. And that's how you place someone in the recovery position. If this video has been helpful to you, help support St John Ambulance by going to sja.org and distressing. If someone's bleeding isn't controlled quickly, they may develop a life-threatening condition called shock, and they may become unresponsive. Bleeding from the mouth or nose may affect their breathing, so try to ensure that the airway is kept clear. An obstructed airway can be a cause for a casualty to become unresponsive. If the casualty becomes unresponsive at any point, open the airway and check their breathing and prepare to treat an unresponsive casualty. To treat someone with a severe bleed, put gloves on if you have them, as this will help to protect you both from infection. If the wound is covered by clothing, remove or cut the clothes to uncover the wound. Is there an object in the wound? If there is, don't pull it out because it may be acting as a plug to reduce the bleeding. Instead, leave it in and apply pressure on either side of it to push the edges together. If there is no object in the wound, apply direct pressure on the wound with your fingers and use a sterile dressing or clean, non-fluffy pad to stop the bleeding. If you don't have a dressing, Ask the casualty to apply direct pressure themselves to stop the bleeding. Jenny, can you apply some pressure for me, please? Brilliant, excellent, well done. Ask a helper to call 999 or 112 for emergency help. Or if you're on your own, use a mobile on speakerphone so you can keep treating the casualty. Tell the emergency services where the bleeding is coming from and the amount of bleeding. The casualty may develop shock, so help them to lie down on a blanket or rug if there's one to protect them from the cold. Raise and support their legs so they are above the level of their heart. Do not raise the leg if it is injured. Jenny, could I lay you down? Excellent. Just going to lift your legs up. Is that okay? Secure the dressing with a bandage that is firm enough to maintain the pressure but doesn't cut off the circulation. Just going to apply this dressing to the feet. Okay. Want to take your hand away? Well done. Okay. Can you hold up for me? Excellent. Okay, can I have this? Okay. Check the circulation by pressing a nail bed or skin beyond the bandage for 5 seconds. Release the pressure. And if the color does not return within 2 seconds, the bandage is too tight. If blood shows through the dressing, don't remove it. Just apply a second bandage on top. Okay, can I have this? Lovely. Okay, excellent. If blood shows through both dressings, remove them and apply a fresh bandage, ensuring there is direct pressure applied at the point of bleeding. Support the injured part with a sling or bandage, but check circulation every 10 minutes. Keep monitoring the casualty's level of response while waiting for help to arrive. So remember, when treating severe bleeding, wear gloves if available. Remove or cut away any clothing from around the wound. Check for objects in the wound, but don't remove them. Apply pressure on either side of the wound. If there is no object in the wound, use a dressing or pad and apply direct pressure to the wound. Call 999 or 112 for emergency help. Secure the dressing with a bandage. Treat the casualty for shock. Support the injured area. Keep checking their level of response while waiting for help. And that's how we treat someone with a severe bleed. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk
Shock happens when the important organs in the body, such as the heart and brain, don't get enough blood or oxygen. Your baby can suffer from shock if they've lost a lot of bodily fluids. This could be from diarrhoea, vomiting, burns or dehydration. Your baby may also suffer shock if they have had a severe allergic reaction, a severe infection, or if they are bleeding heavily. If your baby is in shock, you might see some of these signs. They may look pale and unwell. Their skin may be cold and clammy. Their breathing may be fast and shallow. They may not be feeding or urinating. They may make a grunting noise when they breathe, or they may yawn or sigh a lot. They may appear confused and not respond as normal. In severe cases, they may become unresponsive. If you think your baby is in shock, call 999 or 112 for an ambulance. Explain that your child is in shock and what you think caused it, such as bleeding, diarrhoea, vomiting or an allergic reaction. Lay your baby down with their legs raised higher than their chest. Support the legs on something like a cushion or a rolled up blanket. Do not leave your baby on their own. Loosen any tight clothing around their neck, chest and waist. Keep your baby comfortable and calm, as fear or pain can make shock worse. Keep checking your baby's breathing and pulse and whether they can respond to you. If they become unresponsive at any point, open their airway, check their breathing and prepare to do CPR if necessary. So remember, call 999 or 112 for an ambulance. Keep your baby's legs raised above their chest. Keep them calm and comfortable. Keep checking their breathing. And that's how you treat a baby for shock. Thanks for watching. Help support St John Ambulance. Donate today.
When there's something wrong with your baby, if you know what to do, you'll give them the best chance of survival. If you've found your baby is not responding to you, you'll need to do a primary survey. If they are breathing, try to keep calm and put them into the recovery position. This is the safest position for your baby until help arrives. Cradle your baby in your arms with their head tilted downwards. Then call for an ambulance. Keep checking your child's breathing, pulse and level of response while you wait for help to arrive. And that's how you put a baby in the recovery position. Thanks for watching. Help support St John Ambulance. Donate today. If you ever find your baby is not responding to you, you will give them the best chance of survival if you know what to do. If you have found your baby unresponsive and not breathing normally, you will need to perform baby CPR. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have a speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the centre of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. So remember, if your baby is unresponsive and not breathing, call for help. Ask a helper to call 999 or 112 for emergency help. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. Give 5 initial puffs covering both the nose and mouth, then 30 chest pumps with 2 fingers to the centre of the chest. Continue CPR with 30 pumps and 2 puffs until help arrives. And that's how you do baby CPR. Thanks for watching. Help support St John Ambulance. Donate today.
Babies love exploring, but their little fingers and hands can easily get stuck in small spaces. Sometimes they may get hand or finger injuries, such as bruises, cuts or fractures, or they may hurt or sprain their arm or wrist. In the following steps we'll cover hand and finger injuries, then we'll cover forearm and wrist injuries. If your baby has trapped their hands or fingers, these are the things to look for. They may find it hard to move their hand or wrist. They may feel pain in the area. The hand or wrist may be tender and there may be swelling or bruising. If you think your baby has a hand or finger injury, take the following steps. Sit or lie your baby down and try to raise and support the affected wrist and hand. If there is any bleeding, run the cut under cold water first, then loosely cover the wound with a new sterile dressing or large, clean, non-fluffy pad. Call your doctor or see a nurse, especially if your baby's fingernail has been injured or you think there may be a fracture, a broken bone. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. Now we're going to move on to wrist and forearm injuries. If your baby has injured their wrist or forearm, these are the things to look for. The area may be tender and there may be swelling or bruising and they may feel pain in the area. It can be difficult to know if your baby has a sprain or a fracture, but if you think your baby has a wrist or forearm injury, take the following steps. Remember, RICE. Rest. Help your baby to sit or lie down and support their arm in a comfortable raised position. Ice. Apply something as cold as your baby can bear. This could be a cold flannel, an ice pack or frozen peas wrapped in a cloth. Leave the ice pack in place for no longer than 10 minutes. Comfortable support. You could wrap a soft layer of padding like cotton wool around the area. And elevation. Keep your baby's arm raised with something soft like cushions or a rolled up blanket. Call your doctor or see a nurse if your baby is in severe pain or they can't use their hand or wrist at all. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. So remember, for hand or finger injuries, sit or lie your baby down and raise the injured hand. Wash any cuts and cover the wound with a non-fluffy dressing. Pad the hand with something soft. Call your doctor if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. For wrist and forearm injuries, remember RICE. Sit or lie your baby down and raise the injured arm. Apply ice. Support the arm and keep the arm raised. Again, call your doctors if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. And that's how you treat a baby who has hurt their hands or their arms. Thanks for watching. Help support
Hyperventilating is excessive breathing. It's normally caused by extreme anxiety and can happen at the same time as a panic attack. When someone is hyperventilating, they breathe unnaturally fast and deep, which can make them lose more carbon dioxide from their blood than usual. This can make them feel dizzy and weak. When they start to breathe normally again, they should feel better. There are 6 signs to look for if you think someone is hyperventilating. Unnatural, fast, deep breathing. Anxiety or attention-seeking behaviour. Feeling dizzy or faint. Trembling or tingling in the hands or feet. And muscle cramps in the hands or feet. If someone is hyperventilating, talk to them and reassure them. Try to take them somewhere quiet. This will help them to control their breathing. If that's not possible, ask any surrounding people to leave or turn away. Once they have controlled their breathing, advise them to see a doctor as to how they can prevent and control hyperventilation in the future. If you are concerned about their symptoms or if their breathing does not get any better, call for an ambulance. So remember, if someone is hyperventilating, take them somewhere quiet. Ask other people to turn away or leave and encourage them to see a doctor. Headaches are not usually serious and can be treated at home. Common causes include tiredness, stress, an illness such as flu, or exposure to hot or cold temperatures. But headaches can be a sign of a more serious problem, like meningitis, head injury, or stroke. If someone has other symptoms, or it's following a blow to the head, be sure to seek medical advice. If someone has a headache, help them to lie or sit down in a quiet place and give them something cold to hold against their head. This could be a cold compress, it could be an ice pack, or a bag of frozen peas wrapped up in a cloth. Be sure not to leave it on for longer than 10 minutes. For adults, you can suggest they take the recommended dose of painkillers such as paracetamol. For children, you can give them the recommended dose of paracetamol syrup. If someone has other symptoms such as fever, vomiting, a stiff neck and sensitivity to light, be sure to seek medical advice immediately. Or if they become unresponsive, call 999 or 112 for emergency help and prepare to treat an unresponsive casualty. If they have a headache following a head injury, if the headache is not settling or their condition is getting worse, they should also seek medical advice immediately. Remember, get them to lie or sit in a quiet place. Help them to take the recommended dose of painkiller. And if you are concerned, seek medical advice. That's how we treat a headache.
Frostbite happens when parts of the skin and other tissues freeze due to low temperatures. It usually happens to parts of the body furthest from the heart, like fingers and toes. Frostbite usually happens in freezing or cold and windy weather. People who cannot move around are more likely to get it. Someone with frostbite will probably have hypothermia, so be prepared to treat them for hypothermia too. There are 4 signs to look for. Pins and needles to begin with, paleness followed by numbness, hardening and stiffening of the skin, change in skin colour, first white, then blotchy and blue. If someone has frostbite, encourage them to put their hands in their armpits, then help move them indoors or somewhere warm. Then gently remove any constricting items like rings, gloves or boots. Also remember to keep them warm. Next, warm the body part with your hands on your lap or under the armpits. Don't rub because it could damage the skin tissue. But if there's a danger of it refreezing, don't warm it up yet as it could cause more damage. Place the body part in warm but not hot water that's around 40 degrees centigrade. That's 104 Fahrenheit. And be careful not to put it near direct heat as this could cause more damage. Dry it carefully and put on a light dressing, ideally gauze pad from your first aid kit. Once you've done that, help them to raise their limb to reduce swelling. You could use a cushion or sling. You can give them some painkillers for the pain, then take or send them to hospital, but make sure their affected limb is raised. So remember, when treating someone with frostbite, put their hands in their armpits, remove restricting clothing, warm the body part with your hands, use warm water but not hot water to warm the affected limb, put on a light dressing, give them painkillers and the brain is disrupted and starves the brain of oxygen. Strokes are most commonly caused by a clot that blocks the flow of blood to a part of the brain, although some strokes can be caused by a ruptured blood vessel that causes bleeding into the brain. Call 999 or 112 for emergency help immediately if you think someone has had a stroke. If you suspect someone is having a stroke, you can use the FAST guide to identify the key signs. F stands for facial weakness. Look at their mouth or eye. They may be droopy and can't smile evenly. A, arm weakness. Ask them to raise both their arms. They may only be able to raise one. Can you raise both arms for me, please? S, speech problems. They're unable to speak clearly or might not be able to understand what you're saying to them. Ask them a question, such as, what is your name? Can they respond appropriately? Can you tell me your name, please? T, it's time to call 999 or 112 for emergency help and tell them you suspect a stroke after using the FAST guide. While waiting for help to arrive, keep them comfortable, supported and reassure them. Do not give them anything to eat or drink because it may be hard for them to swallow. Keep monitoring their level of response until help arrives. If they become unresponsive, prepare to treat for an unresponsive casualty. So remember, to help someone who has had a stroke, use FAST. Facial weakness, arm weakness, and speech problems means it's time to call 999 or 112 for emergency help. And that's how you help someone who's having a stroke. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
If after performing a primary survey, you find a child who is unresponsive and not breathing normally, call for help. Ask someone to phone 999 or 112 and ask them to bring an AED if one is available, while you begin CPR immediately. If you're by yourself and do not have a speakerphone, start CPR with 5 initial rescue breaths, then 30 chest compressions and 2 rescue breaths for 1 minute before calling for help. To give rescue breaths, open the airway by tilting the head back with 1 hand on the forehead and 2 fingers under the chin. Pick out any obstructions from their mouth to clear the airway, only if you can clearly see something. Keeping their head in this position, pinch the soft part of their nose, allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 5 initial rescue breaths at about 1 breath per second, like this.